The book Children's Types, written by Dr. D.M. Borland. The discussion of sulfur medicine was not completed in the previous video, which I am completing in this video, along with the detailing of the symptoms of THUJA medicine. There is one constant feature that runs through all sulfur chest conditions. It is a very marked sensitiveness to lack oxygen. They cannot stand a stuffy atmosphere. They want plenty of air. They are chilly in drafts. The disturbance is more common on the left side of the chest than on the right, but it is too slight a difference to be of much importance. Sulfur is one of the most commonly indicated drugs in jaundice of children, acute catarrhal jaundice, particularly with the marked intolerance that sulfur has to milk in its acute conditions. Intense skin irritation, feeling of burning heat on the surface, very often with attacks of colic, frequently with attacks of diarrhea. A sulfur diarrhea produces an excoriating discharge, redness and rawness about the buttocks, intense irritation, scratching. The thin type of sulfur patient often suffers from acute rheumatic conditions with the usual characteristics: irregular sweats, feeling of heat, thirst, red tip of the tongue. The actual painful condition is worse from heat. It is rather more comfortable from cold. It is very much better from movement, although it is painful when starting to move, and there is liable to be a red blush of the affected joint. There may also be a history of attack having been precipitated by bathing, either sea bathing or swimming. The desire for fat is very variable in children. It is very common in adults. Most adult sulfur cases want fat with hot roast beef, for instance, but it is by no means so constant in children. Some do not like fat. If they do, it is a help, but it is by no means constant. A number of adults also do not want it. Butter does not come into the fat craving at all. The majority of pulsatile patients with a definite aversion to fat like butter and like cream, but they dislike meat fat and particularly hot fat. Many pulsatile patients will eat fat cold but not hot, but most pulsatile patients will take butter, very often in large quantities. The tendency to sweat is constant in the fatter type of sulfur than the thinner types. Usually have a dry, harsh skin and do not tend to perspire. Another thing which is sometimes a help about sulfur children is that they are extremely pleased with their possessions. The sulfur child toys are the best that could be, and the sulfur child's family is the best ever. They also have an astonishing money sense. Quite a small child has a very different sense of values. Sulfur is not nearly so often indicated as it is used in urticaria, but it is very commonly indicated in urticaria in children, particularly if associated with digestive upsets. Children respond well to any potency, and most sulfur children respond very well to 30 or 200. THUJA. To continue with the pulsatile type of drugs, although majority of these are hot-blooded drugs, there is one other that is always associated with pulsatile, and that is THUJA, although it is chilly in its reaction. It is a little difficult to give a mental picture of the typical THUJA child because in the majority of outstanding cases, there is an element of mental deficiency. In many THUJA children, there has been some mental deficiency, some merely backward, some actually deficient. In some, there is an obvious pituitary dysfunction, and that tends to color one's idea of THUJA. But there are THUJA children who are not mentally defective and who have not got a pituitary dysfunction, and that type of child is very like a pulsatile child in reaction. The outstanding characteristic of THUJA child is the fact that it is sensitive to people. It is responsive to any kindness. It is conscious in what it does, and it is easily upset emotionally. And there the first strong indication comes in. THUJA children have a peculiar sensitiveness to music, and this is one of the things commonly associated with mentally defective children. 80% of the mentally defective children that I have treated have been abnormally sensitive to music. much more sensitive than average child. And even in the normal child with THUJA indications, you get the emotional sensitiveness to music. They are affected by it. They may even weep from it. Associated with that emotional disturbance, THUJA children have a sadness or depression, very like the pulsatilla depression. The THUJA children, even the mentally defectives, are astonishingly conscious. They are very often sensitive to motion, are very often car sick. Another symptom is a strange contradiction often found in a perfectly lively child. They are apparently keenly interested and yet have a strange hesitation in speaking, a difficulty in finding the words they want, or a difficulty in saying them. The difficulty in speaking gives the impression that the child is slow mentally, when it is not really slow, it is really seeking words that may go on the definite disinclination to talk. They are rather silent and appear to be rather heavy. The majority of THUJA children are rather under than above average height. Many are definitely small and rather finely built. THUJA applies equally well to either fair-haired or dark-haired types. A definite factor is that they appear to get weakened the more active they are. If they are made to sit about, they become dull, heavy and depressed, but any activity brightens them up mentally. Another common feature in many of these THUJA children is very faulty development of the teeth, with irregular dentition and very early decay. The enamel of the teeth is definitely faulty in places. THUJA children are sensitive to cold, although they are mostly better in the open air. They are very sensitive to damp and liable to be much worse in the morning. Most THUJA children perspire on exertion, and even when they are not exerting themselves, they mostly have a rather greasy skin, which is more commonly noticed in the dark-haired type than in the fair. Some fair-haired THUJA children have a rather fine skin and very often a downy growth on the skin, particularly on the back. THUJA children do not stand up well to mental stress. They are liable to get typical acute neuralgic headache under stress from getting overtired or overexcited. And the point about the neuralgic headache is that it is very often pick up definite areas which are extremely painful and very often extremely sensitive. These children tend to get chronic catarrhal headaches. They get sick, purulent yellowish green nasal discharge, possibly with crusts in the nose and bleeding. They are liable to chronic otitis media and may develop a mastitis with very severe and localized pain and tenderness over the mastoid region. If they are old enough, they will tell you it feels as something were being bored in the mastoid bone. Another common feature to THUJA children is a poor digestion. The typical picture of the pituitary child with an almost pendulous abdomen is an extreme example, and these children are extremely liable to develop a chronically irritated cecum. Often there is a full boggy cecum in the right iliac fossa with a history of recurring attacks of diarrhea, and the diarrhea is fairly characteristic. It consists of pale, greasy, almost fatty stool, and these are always passed with a good deal of flatus, and the attacks are accompanied by a lot of gurgling in the abdomen. Very often these children give a history of having crops of warts. The THUJA warts are soft and bleed easily on handling. If knocked, the surface may break and bleed. THUJA patients sweat on the uncovered parts. A girl of about 12 years of age was stripped to be examined, and the sweat poured off her when her clothes were removed. She was not sweating at all when covered. Occasionally, that odd symptom of sweating when uncovering is found, but usually THUJA children are chilly and shivery when uncovered. The particular case was of interest because there was a rare bony deposits on the muscles in the quite a young child, and she did very well on THUJA. The first pointer of the possibility of THUJA was the odd sweating when uncovered. The other constant THUJA feature is in children of their strange susceptibility to onions. They are very liable to gastric upsets and an attack of diarrhea from eating onions, cooked or raw. Another symptom, although not met with the young children, may occur in adolescents. They are liable to get acute digestive upsets from tea. A history is also a great help in deciding on THUJA. In Enlarged Glands in Children, Dr. Borland described the symptoms of THUJA very well. The next medicine, bromium, in the next video.